The following program is paid for by the Spinal Disc Regeneration Center, Watertown, New York. Do you suffer from back or neck pain? If you're tired of taking a back seat to your chronic back or neck pains, then lean forward and listen carefully because this program is for you. Let's join Dr. Becky Kashmiri as she introduces us to a world without pain at the Spinal Disc Regeneration Center on Arsenal Street in Watertown. This is the home to the VAX-D decompression table, the industry's leading state-of-the-art unit that is the only one of its kind in our region. Today's show will demonstrate how local people, just like yourself, have changed their lives with VAX-D therapy at the Spinal Disc Regeneration Center at Northern Lights Chiropractic. And now, ladies and gentlemen, Dr. Becky Kashmiri.
Hi, my name is Dr. Becky Kashmiri. Today we're going to be talking to you about the fantastic benefits of having VAX-D spinal decompression done to your back. It's specifically designed for bulging, herniated disc, degenerative disc disease, failed back surgery, leg problems, also for neck problems. Today we're going to be talking to many patients who have had great success with VAX-D spinal decompression. We've had patients that have tried everything in the book. They've tried physical therapy, they've tried back surgery, everything imaginable. VAX-D spinal decompression research shows has an 89.9% success rate of preventing back surgery. We've been here at Northern Lights Chiropractic now for 29 years we've been practicing. And around 2.5 years ago, we added VAX-D spinal decompression to the practice, which is a full separate facility. And because of its huge success with back and neck pain, we added it to the practice. What we're going to be doing today is going over the history with you of somebody going through the procedure of VAX-D decompression. It's a non-invasive therapy. You lay down on the table, face up or face down. The pulling and decompression of the patient will biofeedback into the computer. So the computer knows exactly how much tension and pressure is being pulled in very, very specific areas of the spine, whether it's the neck, the mid-back, or the lower back. And what it does is it will actually concentrate on that area of the spine, of the discs, and it will slowly start pulling. And as it starts pulling, it will then decompress. And as it decompresses, the disc in your spine will actually start vacuum sucking back in. Research shows that it's 160 negative pounds of pressure that will go into your spine. It's soothing, it feels wonderful, there's no pain in having the procedure done. And even when you're done with your treatments, when you're done with your program, 30 to 60 days after, the spine is regenerating the disc so that a healing of the disc can happen. So we're going to be talking about some patients today that were up against the ropes. They had severe pain in their necks, in their backs. They were slated for back surgery, and they came in and started having treatment done. And their success stories are unbelievable, how much better they are today as a result of this therapy.
I woke up one day and was not able to lie down flat, stand for any amount of time, sit for any amount of time, or exercise at all.
Interestingly, Susan, like many other people with neck or back pain, was unable to pinpoint exactly how the pain began in the first place. With only days before a scheduled surgery, Susan decided to begin therapy sessions on a VAX-D decompression table. This is her story.
In waking up overnight, my life changed completely. I wasn't able to keep up with my kids, put in a full day of work. The pain was excruciating, and in my arm and in my neck and in my shoulder, and the headaches were debilitating. And I got them daily. Upon just an initial cursory examination, the chiropractor took some x-rays and sent me for an MRI. The MRI proved that I had a bulging disc and a compression on a nerve. And when I came here to talk about decompression, the surgery was actually scheduled for the next week. 8 short sessions here. That entire negative outlook has changed 360. I feel great. I'm beginning to exercise again. I'm back out running, and the excruciating pain, that high level of constant intense pain that I had along with the headaches, it's gone. I believe that decompression made that pain go away. It eliminated the worst pain in my body. As a result of this experience, a combination of the decompression and the regular chiropractic adjustments, I'm going to plan on chiropractic care for the rest of my life.
We asked Susan what it feels like during her therapy sessions on the VaxD regeneration table.
I feel the pulling and the stretching motion contributes to a feeling of release of pressure, I believe, on my spine and my neck. And I feel that much less restriction in my ability to move my neck up and down or to the right or to the left. Less intensity of pain and restriction from my neck down through my shoulder.
Susan's success story is one of the many happening today at Northern Lights Chiropractic, the home of the Spinal Disc Regeneration Center. Today, through a series of therapy sessions at the center, Susan's life is back to normal. Plus, she avoided serious neck surgery altogether. So, what's happening to Susan's neck? To explain this amazing healing process, Dr. Becky will first explain the basics of the human spinal cord and the phases of disc degeneration.
This is a vertebrae of a healthy disc. These are the vertebrae, these are the discs, and these are the nerves that exit out of this hole. This disc is as hard as a bicycle tire, and the nucleus, the gel-like substance, is in the middle. When you go out of alignment from various stresses, like falls, twists, sporting injuries, even the birthing process itself can cause a misalignment in the spine, which is called a subluxation. That will start cutting off the function of the nerve flow by 40%, which goes to all your organ cells and tissues. We'll adjust the spine to get the pressure off the nerve, but if this condition of subluxation and misalignment is left for long periods of time, it'll start squishing on the nerve, it'll start deteriorating the discs, and bone spurs will develop like this. This is phase 1 of degenerative joint disease, otherwise known as arthritis. And this is what happens. Then, as more time goes by, it goes into phase 2 of degenerative joint disease, where bone spurs will start developing. The body's actually trying to fuse this. And what happens to the disc is it starts dehydrating, and the nucleus, the gel-like substance, will ooze out, and that's called a disc herniation. Now, what spinal decompression does is it will gently start pulling this apart, and it'll go back and forth a number of times through so many cycles, and this disc matter will start vacuum sucking back in. It's kind of like taking a tube of toothpaste and squeezing it, and the toothpaste comes out. You squeeze it the opposite way, and the toothpaste sucks back into the tube. That's pretty much what we're doing with your disc. If you leave this condition and it goes into phase 3 of degenerative joint disease, then the disc becomes so dehydrated that it's like a beef jerky, and you get a skinny, dead, dying nerve that's dehydrated. And at this point, people are usually having a lot of health conditions because the nerve innervating their organ cells or tissues are very, very depleted in function. Through a series of treatments on VaxD spinal decompression, normally we could take just enough pressure off of that atrophied nerve like this, so that we can start getting just some of the function back and hopefully get rid of the pain.
We're at the Spinal Disc Regeneration Center on Arsenal Street in Watertown, the home to Dr. Becky Kashmiri and her staff. This is the location of the most state-of-the-art mechanisms, the VaxD decompression tables, the answer to a life without back or neck pain, and the final solution to costly and dangerous surgery.